What is diabetes and what are the different types of diabetes? Diabetes, also called as hyperglycemia, is a metabolic disorder which causes the blood glucose levels to rise beyond the normal limits. So when will a doctor say that you have diabetes? If your fasting plasma glucose, which is done after 8 to 12 hours of overnight fast, is more than or equal to 126, if your postprandial plasma glucose or glucose which is measured after consuming a oral glucose tolerance test is more than or equal to 200, or if your HbA1c, which is a 3 months average blood sugar, is more than or equal to 6.5, or a random blood sugar which is done any time of the day, if that is more than 200 and you are experiencing typical symptoms of high blood sugar like excessive thirst, excessive urination, excessive weight loss and excessive hunger, any one of this is enough to confirm the diagnosis of diabetes. So why does the blood glucose levels rise? We all have an organ in our body which is called pancreas. Pancreas produces insulin hormone and insulin is required to maintain the blood glucose levels within normal limits. Now in a patient with diabetes, the pancreas is not able to produce enough insulin, so there is insulin deficiency, or the body is not able to use the insulin effectively, which is called insulin resistance. So either because of insulin deficiency or because of insulin resistance, there is a sustained rise in blood glucose levels which is called diabetes. So what are the different types of diabetes? Type 1 and type 2, these are two most important or most common type of diabetes. Type 1 diabetes was earlier also called as insulin dependent diabetes or juvenile onset diabetes. It is very less common. Only 5% of our patients have type 1 diabetes. It occurs usually in a child or adolescent less than 10 years or 15 years of age. Now in a patient with type 1 diabetes, their pancreas does not produce any insulin. So there is absolute insulin deficiency. Therefore, a patient with type 1 diabetes have to take permanent insulin injections throughout their life to control their blood glucose levels. Type 2 diabetes, earlier also called as non-insulin dependent diabetes or maturity onset diabetes, is the more common type of diabetes. Almost 90 to 95% patients that we see in our practice are type 2 diabetes. It usually occurs in an adult after the age of 35 or 40 years. But nowadays, because of lifestyle, stress and other factors, we are also seeing patients in their 20s who come with type 2 diabetes. And we also see adolescents in their 12 to 18 years of age who come with type 2 diabetes, which is called as early onset type 2 diabetes. Now in a patient with type 2 diabetes, the pancreas is not producing enough insulin, so there is relative insulin deficiency, or there could be insulin resistance. Type 2 diabetes is initially managed with lifestyle changes, so your good diet, exercise for half an hour and weight management. And then we use oral medicines to control your blood sugar levels. But it is a progressive disease, so over a period of time or after 10, 12, 15 years it progresses, and in spite of taking 2-3 medicines, when you fail to maintain blood glucose levels, that is the time your doctor will shift you to insulin therapy. Thank you.